The nurse-initiated and managed antiretroviral treatment training has improved the provision of ART to people living with HIV/AIDS who are unable to access hospitals. The program has also reduced the congestion of patients at hospital facilities. ART is the use of HIV medicines to treat HIV infection. In an interview with Nampa, Oshikuku District Hospital Senior Medical Officer Dr. Samuel Awe expressed optimism regarding people's access to ART in remote areas. Awe said the number of people living with HIV and AIDS and having access to ART has increased in the district since NIMART's implementation in 2015.
Now, for that process to go smoothly, nurses are selected and trained basically on provision of ART services following the Namibian guidelines for provision of antiretroviral services for members of our community. And this is where IntraHealth and other organizations have been supporting us, especially also Ministry of Health, who is also our stakeholder. So before you allow any nurse to be able to prescribe antiretroviral medicines or medications to patients, they must be trained in the guidelines and they know the process so that we do not have problems. Remember, before the issue of NIMART, we had doctors mainly providing these services to patients, meaning all patients practically come to the district hospital for treatment. But then, after some time, we noticed that the centers where these programs are being provided are always jam-packed. People are not able to even come. At times they don't have money. Our patients can't come because they do not have money. And then government thought of using nurses to provide this service to the community, to members of the community.
In the past years, access to ART meant specialized doctors and patients had to travel long distances because ART was only available at district hospitals. In 2015, the Health Ministry partnered with USAID HIV Clinical Services Technical Assistance Project, known as UTEP, and managed to provide NIMART training to over 180 nurses and administrative staff in Namibia. Thomas Lazarus, a nurse mentor at the Oshikuku District Hospital, underwent the NIMART training and is now responsible for mentoring other nurses in the district.
Instead of having a stable patient queuing there for 7 or 8 hours for nothing, you keep them in the community where they are, or the other one you decentralize to their nearest health facility, and then you focus on those patients who really need attention. And then everyone is happy, patients are happy. You can even see the face of healthcare workers. It used to be a long face because of the long queue, but now, like here you observe, not many patients. It was a disaster here when we had all these patients, because we decentralized a lot of thousands of patients from here. That's why even 2 nurses now can manage this one.
The UTEP program started in February 2015, and after the first year of implementation, USAID and IntraHealth modified it to expand the program's scope and geographic coverage to HIV prevention, care, and treatment services to areas with high HIV prevalence rates. IntraHealth is a US-based network of health workers around the world that focus on developing the skills of health workers. NIMART also includes a mentoring program for nurses and doctors to ensure training is applied accordingly. NIMART is part of the Health Ministry's decentralization of HIV-related services and is being done with the support of PEPFAR.